So we have a daughter, her name is Emma, and she is 19 now. When she was about 12, she came to me one day and she said, "Dad, I don't think God likes me. I don't think I'm a good person." So a little bit after that, she started washing her hands obsessively until they were absolutely raw. She developed severe anxiety. "I can't sleep. I just can't get to sleep." She was afraid anything I was cooking for her was raw and that it was going to make her sick. Her grades tanked, and this once compliant, sweet little girl became extremely, extremely defiant.
We've been physicians for 20 years at this point, ER physicians, and we'd never seen anything like this. It was terrifying. So like any good parent, we dial the phone number to the pediatrician. "Hey, our daughter's had some really weird symptoms." "I have no idea what that is. It sounds like you need to take her to the OCD clinic at the Children's Hospital." That just didn't sound right, so I hid the books and started,
In the computer.
and started turning the pages night after night, hour after hour, until 10 o'clock one night, and I said, "Scott, I know what Emma has. She's got pediatric autoimmune neuropsychiatric disorder associated with strep. She's got PANDAS."
So I looked, and sure enough, she had all of these signs. So PANDAS is a condition where children get an innocent enough strep infection, and in their body, when making antibodies to fight the infection, these antibodies cross their blood-brain barrier and attack a specific portion of their brain, giving them all the symptoms Emma had and even more. So once we figured this out, I thought, great, now we know. I picked up the phone the next day and I called infectious disease doctor at the Children's Hospital. And I said, "Hey, this is what's going on with my daughter, and I think she has PANDAS, and we could really use your help." And he said, "PANDAS doesn't exist. I can't help you." Click.
We don't give up. We do not give up. Back to the books it was. Going through books again, and I remembered as I was researching that I had heard a lecture in one of my studies from a physician in New York who actually treated children with complex medical conditions, and I remember him talking about PANDAS. So excited to have somebody who knew about this. I picked up the phone, called him the next day, and he said, "Of course, come." We're off on a plane. We show up in his office. He takes one look at our daughter, and he said, "Absolutely, this is PANDAS. She's got this blank stare. She's obsessively washing her hands." I was terrified, but I was thrilled to have a diagnosis.
So they came back, and I thought, now we have more hope. We have another direction. So I picked up the phone and called to another children's hospital and spoke to a pediatric neurologist who I knew used IVIG for other reasons, and said, "Hey, this is what's going on with my daughter. These are her symptoms, and we really could use her help. I think she could use IVIG." And he said, I don't know. I think sounds like she just needs to be on antipsychotic medicine and locked in a psych ward."
I mean, can you imagine? That cannot be the only answer. There has to be an answer. I mean, we have a diagnosis, there's a treatment, there has to be an answer. So we searched and searched and found a doctor who would give her the intravenous immunoglobulins that the doctor in New York told us she needed. And 4 days after receiving treatment, we had our daughter back. It was like the light bulb had gone off. She was sorry for her behavior, which we didn't expect, but she woke up. She knew that she had been kind of gone and came back to us. It was such a relief.
And I often think since then, if we had just kind of given up and, given her the medication and maybe locked her in a psych ward, which at that point she was really sick, that may have been something we could have done. But, would she be playing soccer for a Division I college right now and have a ton of friends and be able to basically eat anything that I cook for her? I don't know.
We were never going to allow another family to experience what we experienced. It was horrible. We had already been seeing complex patients in our office, and it was at this point that it really helped us hone in on our 5-step proprietary process, our fully functional process, so that you don't have to experience what we did.
So, Dr. Ellen made the diagnosis of PANS in our daughter, and she's really most well known for taking care of these complex medical conditions. That's what we do in our office. And she's an expert in mold illness as well as Lyme and other complex medical conditions. But When Emma had PANS and we were able to use our process to help her recover, that's when I knew my specialty had found me. And I've dedicated my life since that time to learning as much as I can, writing as much as I can about this illness, and finding new and innovative ways to treat this in our office where we see these children.
We are so thrilled to have you here with us. We know that you're going to learn so much, and we hope that the things that we teach you over the next several modules will help you and your family and your child become fully functional for life.
There is hope for recovery. That's the one message we always want to leave you with throughout this program. And so stay tuned for our next video where we're going to tell you the best way to use this course and exactly what you can expect.